All right, joining me now on Skype from Ibadan is Dr. Augustine Onyegala, a medical laboratory scientist and an adjunct associate professor in medical lab science. It's good to have you join me right now, Dr. Onyegala. Now, the point there is the vaccines have been rolled out and states are taking delivery of this, and the issue of the possibility of fake drugs or fake vaccines getting into the market is still out there. I wonder what you're hearing and how wary we should be.
Thank you very much this morning for having me again on TVC News. Yeah, for everything that has genuine parts, people will always want to be smart to get a counterfeit one. So counterfeiting and faking is not new in drug and vaccine production. But the good thing is that the government has the appropriate regulatory agencies to ascertain the validity of every vaccine that is out there. We keep talking about validity. It is the responsibility of the NAFDAC to test every vial of vaccine out there to ascertain that the vaccine works and the vaccine contains required immunity in every individual that receives this vaccine. So when it comes to faking and counterfeiting, that's people will always want to make quick money. So, but appropriate quality assurance systems, which government has put in place, need to be followed to ascertain that whatever Nigerians are receiving definitely is the right vaccine meant for the people. So it is strictly lies under the purview of the NAFDAC to do the right thing, and this is exactly where we need to join NAFDAC at this particular point in time. Yeah.
All right. When the vaccines arrived, there was an assurance that a few vials would be given to NAFDAC for, background checks and verification. But we haven't heard the outcome of that verification, and the vaccination or the inoculation process is ongoing. Is the verification by NAFDAC a mere formality?
Well, I think I saw the schedule that the government shared as per rolling out of this vaccine that's currently in town. NAFDAC was to test the vaccine between 3rd and 4th of March. That is just about a day or 2 days to test the vaccine before the vaccine is rolled out to the population. The question scientists are asking, what should NAFDAC be testing between 3rd and 4th of March? That's a question that NAFDAC needs to answer. And whatever they have texted needs to be made public on the public domain so everybody will know what they have texted and what they have seen. I don't really know why Nigerians are too secretive at some of these things. Because this is something that involves human life. This is something that people need to know, that the vaccine you have given us, we love it and it's safe. So NAFDAC has the responsibility to say, we have done this particular testing, this is what we have found. It should be on public domain. So I keep asking, if Nigeria had manufactured COVID-19 vaccine and then shipped to US, FDA, or UK, Europe, would any of those regulatory agencies begin to use this vaccine manufactured in Nigeria by Nigerian scientists on our population? FDA will never do that. The European Regulatory Agency will never do that. And now NAFDAC knows this, and the government of Nigeria will know this. So why is it that NAFDAC shouldn't be allowed to do the right job, taking the right scientific process to get Nigerians informed about the report, the validation report they have performed on the vaccine, so that they can buy the confidence of Nigerians regarding this vaccine? So giving them that 3 to 4 days to test validity of vaccine or whether the vaccine is safe, before scientists and experts can comment further, they need to see what NAFDAC has tested, and then we can be able to judge whether it's enough to prove that the vaccine is good for us here or not.
All right. Now, there are some reports in some quarters that there's a possibility that going forward, the issue of vaccination, being certified to have been vaccinated, will become a criteria for anyone to travel abroad. I wonder what you make of that.
That's interesting. Exactly. This is where a lot of people will are caught in the web of the vaccination. A lot of people have discussed with, and I mean experts, scientists, professors who are real scientists. They are still doubtful whether they would take the vaccine or not. But with the clause of no vaccination, no travel, that becomes an issue. Here, it may have to go just beyond scientific explanation, but it becomes very ethical issue. People have right to make choices. They have right to say, I want, I don't want. And in ethical research and ethical practice and individual rights to accessibility or quality health, people have the right to make choices. So if I decide not to choose, not to have the vaccine, why should you punish me for traveling or not traveling? So the lawyers may have to come in here to really look at the legal implication of that decision to see whether it's infringing into the human rights of a typical Nigerian or a typical scientist or professional who outside or anywhere he decides to go, and then somebody tells you because you don't have vaccination against COVID, you don't need to travel. So it's a mixture of health economy, it's a mixture of science plus legal implication plus public health. So experts in this area may have to come together to look at these issues and then educate Nigerians on next steps.
Now, talking about
okay, go ahead.
Yes, talking about the educating Nigerians, I wonder if you feel that Nigerians have been enlightened enough to voluntarily accept or present themselves for vaccination, especially with the COVID-19, with all of the things they have heard. Government assured and government has assured at different fora where government has the opportunity to speak to Nigerians on either a news report or a press briefing, as the case may be. They keep assuring Nigerians that the vaccine is safe and calling up. But do you think that is enough?
Well, seriously, I don't think government has done a lot of public community mobilization and education of Nigerians. The issue is why are Nigerians averse to current COVID-19 vaccine? Vaccine and vaccination is not new. And I think we need to go into the basics of this COVID-19 vaccine. The issue of COVID-19 vaccine is the way it was manufactured using messenger RNA. Yeah, everybody, I have taken a lot of vaccine. I've taken yellow fever when I was young. I took measles. So everybody does that, or everybody did that. But the issue about COVID-19 is the messenger RNA that was used to develop the vaccine, which is very new technology, which is very new. It's only COVID-19 vaccine that has been manufactured using this technology. So people are saying that if I take the vaccine, a messenger RNA is introduced into my system, messenger RNA from COVID introduced to my system, then it goes into my own nucleic acid sequence and then produces a spike protein. The spike protein, the body sees it's an antigen, so the body also produces an antibody against the spike protein originally produced by the messenger RNA introduced to my system. So the question is, what happens to the messenger RNA that was initially introduced through vaccination? This is where government needs to educate Nigerians to let them understand that the mRNA introduced into your system will not begin to mutate into your system and cause other effects into the system. So we need a lot of education. And this is where agencies like the National Orientation Agency, we have to really go into the science of this, simplifies it, and then go to Nigerians and tell them this vaccine is like this, is like this, is like this. Nigerians take vaccine regularly. So for you to buy their confidence back, you need to educate them using evidence-based data, evidence-based information to tell them that this vaccine is safe. Remember, when we talk about safety, it's a matter of time. What is safe now may not be safe in the next 1 year. What is safe now, for us to find toxicology, safety is a function of concentration and time. So something may be safe and now, but in the next 5 years, is it safe? And this is also where now that we begin to talk about pharmacovigilance. Are there systems in place to talk about it? As I'm talking to you now, there is no structure in place to do phase 4 trial for this vaccine, which is pharmacovigilance. So now that needs to do a lot of things to buy the confidence of Nigerians when it comes to this vaccine, taking the vaccine, and the aftermath effect of the vaccine in the next 1 year, 2 years. We need that.
All right. Now, the aspects of your explanation, it takes us really deeper into what all of this could mean, and these are the information that people out there need to come out, because people have, due to the conspiracy theories and some of the things people have heard, a lot of people are skeptical about the vaccination, apart from just the word, the assurances given by government to people. These kind of explanations will need to go out to people so they can understand. Now, let's talk about the issue of local production. Scientists like you and so many others have assured time and time again that Nigeria has the capacity, has the skill, has the manpower, has the wherewithal to produce local vaccines for this. What they might need is funding and the right atmosphere and all of that. Talk to us from that window again, because a lot of Nigerians feel that all of the professors we have, all of the labs we have, and all of the resources we have when it comes to raw materials and root and herbs and all of that, there must be something somewhere that we can use.
Yeah, I think strictly it's about putting our priorities right. If you look at the budget government has currently for logistics for COVID-19 vaccine currently rolled out, we read in the newspaper that about 10.6 billion naira is going to be spent on logistics, maybe moving the vaccines from one federal ministry, from Abuja to other states and things like that. 10.6 billion naira for a vaccine that we got free. Now imagine if that money is just set aside and then Nigerian scientists are mobilized and say, take this 10.6 billion naira, give us a cottage vaccine industry that will serve Nigerians in the next 5 years. Guys, I think it's going to be very innovative. 10.6 billion naira. So people are asking, are we using charter flights? Are we using this and that or whatever? So manufacturing of vaccine is still the best approach for this nation. It's, aside inoculating Nigerians with the vaccine that will come out of that production process, the amount of jobs it will create for people in this nation. I really don't know why government still has flair for vaccine importation rather than developing it in country. I don't really know why. Because we have this capacity, we have the structures, we have the scientists, we have the people. We can even do partnership with international organizations abroad. There is no law that says a particular country can start production of vaccine from start to finish. You can outsource certain part of these processes. It is shameful that the entire continent of Africa, nowhere, including the South Africa, we're expecting to do something. Morocco and Egypt, these are big guys who are known who are very well known in pharmaceutical manufacturing. Everybody is looking for vaccine from Europe or America. So Nigeria will definitely need the management, the policymakers need to go in-house and really find a way we can solve this local production of vaccine. Ebola is with us. Nobody has been on vaccine for Ebola. It's been threatening us for over how many years? HIV has been with us since 1980s. Nobody has been on the vaccine. So people solve problem once it protects their interests, and that's the truth about public health. So that's just my take. So government needs to do a lot of things to ensure that vaccines are produced locally for the benefit of Nigerians. And we also know the biological benefits for that particular process.
All right. Now, there are concerns, still concerns in many quarters that when these vaccines leave Abuja, I recall that you and I have talked about this thing some time ago over the last week, the issue of hoarding, because we have seen this in so many other issues, things meant to be distributed to people free of charge. We recall the issue of the palliatives during the COVID-19 that were stocked in warehouses that were not given out. We recall so many of the donations that were meant for IDPs in the past few years that were not given out until they were rotten and spoiled. When it comes to this, what concerns do you have with the possibility of hoarding this thing, the vaccines to be given to family members and others by officials?
Well, that's people say there's always a Nigerian factor in everything, but we should not put Nigerian factor when it comes to public health issues of this proportion. Vaccines are drugs. They should be deployed for the use of the people. But if you listen to news a few days ago, government had a concern of the preparedness of states to handle these vaccines. Some states, you're already hearing that they are not ready to receive it. They don't have capacity, they don't have this, they don't have that. And that's the issue we've been talking about. So how prepared are the states to even receive the vaccine and then put them in appropriate cold chain system? And then there, are those cold chain have they been monitored over the months, over the years to ascertain that they are working to utmost level? Is it just because an ad hoc arrangement that we are receiving vaccine next month or next day, and then the particular state begins to fix the cold room and things like that? Can we sustain such arrangements? These are issues. So how ready are the states? If the vaccine gets there, are there systems in place that the states have put in place to ensure that the vaccine gets to remote areas? Have the vaccinators been trained? Have they been taken through the basic SOPs of vaccination and how to go about it? These are all questions that the states, with our workforce, in collaboration with the state ministries of health and primary health care agency or board, we need to sit down and then develop a system and a strategy that will help ensure that this vaccine gets to the people that need it, even in the remote places. We keep talking about far to reach and hard to reach areas. These are realities in public health. You could get to a place that you may not have to find a way to get there. And there are plans to make sure that people in these areas get these vaccines. So these are issues. And you need technocrats, you need people who can sit together to come out with a strategic action plan on how to make these things effective. Otherwise, we may not, even though we got the vaccine free, the expected outcome and impact may definitely be hard to achieve.
All right. Now, before I let you go, the point there is, like you mentioned earlier, that and everyone agrees that we're not new to issues of vaccines. Nigeria is very used to it, and a lot of us as children took vaccine, and most recently the polio vaccine was very successful when it comes to the template of distribution to all houses where children need the vaccine. Now, the polio template, would it be adequate to be used in the COVID vaccination process?
Definitely, it's going to be very effective because when you look at science and public health, what has worked, you look at that's what we call implementation research. You look at the hiccups to people getting effective treatments and then designing policies to addressing those hiccups. That's exactly what was implemented for polio. We looked at scientists and immunologists look at the challenges restricting people from getting polio vaccine. Then a typical implementation science was implemented to address that challenge. So we can strictly do that for COVID-19 vaccination. So, and it recalled that polio was going to people house to house, and house to house visitation has a lot of effect in helping scientists and public health experts achieve desired outcome. I recall when we did NICE project, it was house to house. People were visited in their homes. There were a lot of community mobilization, there were a lot of social mobilization, there were a lot of handling of gatekeepers. These are important people who will play a great role in ensuring that the desired public health impact of every intervention or program is achieved. So that template for polio could work well if Nigeria adopts to that and then uses it to address the current COVID-19 issue. But as I say again, it requires the collaboration and cooperation of local people, the imams, the pastors, the reverends, everybody in that community needs to be carried along, be taken on the same, or put on the same page, and then they go to your people and tell them, this is safe, you need to take this so that we can have limit escalation of COVID-19 infection within our community. So it's a very brilliant template that government can adopt to address this issue.
All right. One other thing is the issue of access to some terrains in the country. We recall there are some terrains that are, riverine. Others have desert. Others have forests. Others have mountains. Some there are island communities. And then the other challenge there is the issue of security, especially in the northern part of the country where we have kidnappings and banditry and Boko Haram terrorists here and there. How will this impact the distribution of vaccine to people who need them?
I think I addressed it before, but to elaborate on this, it still lies on the states. The primary healthcare development agency in respective state, we have to sit down and look at challenges peculiar to them. Every state in this country has a different challenge, has a different terrain, has a different issue. And most of those issues may not be addressed from Abuja. And that's why health issue is in concurrent list of this constitution. Every state has power to make rule for health matters concerning our state. So the state and the state governors and the ministries of health and all the agencies within that ministry of health, we have to come together and then look at policies, address peculiar issues to the people, and then use the people within the community to reach the people. It's very hard for you to bring somebody from Abuja and tell them to go to a village in Kano to immunize people. They will be resistant to that. But when you bring people within that community, you train them, you educate them, then you mobilize them to go to your people. These are community guys, community mobilization. So let the community be part of the process. And once they are part of the process, they take the solution to the people. These are people we see every day, and I'm sure since you see me every day, you may not bring something that will going to harm me. So government, it's a lot of strategic thinking, strategic planning that will enable us to really get the best benefit we require from this vaccine. Otherwise, if you don't put appropriate systems and structures in place, you may just find out that the vaccines will be wasted at the cold room, at the state level, and will not be accessible to the people. And then if it's not accessible, then that brings about a kind of question in equitability, distribution of health benefits to the community that needs it. So a lot of planning, a lot of strategic thinking is needed to get these things resolved.
All right, Dr. Augustine Onyagala, thank you so much for your insight into all of this, and thanks for what you do as well.
Thank you for having me again. Have a nice day.
Thank you.